Hello, my name is Werner Bischoff, and welcome to this presentation on developing a cybersecurity strategy and risk management plan in the healthcare sector. In this section, I will walk you through the fundamentals of cybersecurity, the current threat landscape, and the NIST cybersecurity framework. We will also explore risk assessment, explore employee training and compliance, mitigation and resilience measures, and finally, we will look at emerging trends and the future outlook for healthcare's cybersecurity. In today's healthcare environment, cybersecurity plays a critical role in protecting patients' safety and data privacy. Hospitals and clinics depend on electronic health records and digital platforms to deliver care, but these same tools also introduce new vulnerabilities. Attacks such as ransomware and phishing have become increasingly common, sometimes forcing hospitals to suspend critical services. That's why cybersecurity in healthcare isn't just a technology issue, it's a matter of patient trust and overall well being. Let's take a closer look at the current threat landscape. Ransomware remains the biggest challenge. Attackers encrypt hospital data and demand payment to restore access. Phishing is another major threat. One careless click can expose login credentials and compromise sensitive patient records. As more Internet medical things devices, such as monitors and infusion pumps, connect to hospital networks, the number of potential entry points continues to multiply. A single incident can disrupt operations, violate HIPAA regulations, and cost millions of dollars in recovery efforts. To build a strong cybersecurity posture, our plans follow this NIST cybersecurity framework. It organizes activities into five core areas: identify, protect, detect, respond, and recover. This approach helps healthcare organizations manage risk systematically, from identifying assets and threats to implementing protective measures, detecting abnormal activity, responding quickly to incidents, and restoring normal operations. The framework provides a clear, repeatable structure that aligns cybersecurity goals with business objectives. Our cybersecurity strategy focuses on prevention, detection, and leadership. First, all data, especially EHRs, should be encrypted both in storage and during transmission. We are also transitioning from traditional passwords to passkeys, a major cybersecurity trend that greatly reduces risk of stolen reused credentials. Real-time monitoring enables the quick detection and isolation of suspicious activity, while strong governance ensures that cybersecurity decisions receive full leadership support from appropriate fundings. Risk assessment is the foundation of an effective cybersecurity plan. The process starts by identifying the most valuable assets, such EHR databases, medical devices, and cloud systems, and evaluating which vulnerabilities put them at risk. We then assesses the potential impact of each threat, including financial, operational, and reputational damage. Following Deloitte's guidance, our approach emphasizes optimizing cybersecurity spending, focusing resources where they deliver the greatest protections for the cost. The goal isn't to spend more, but spend smarter. Technology alone isn't enough. People remain at the heart of cybersecurity. Many breaches start with simple human errors, such as clicking on phishing emails or mishandling passwords. That's why ongoing employee training is essential. Regular phishing simulations, data protection workshops, and clear reporting channels help staff stay vigilant. Compliance with regulations like HIPAA and GDPR protect both organizations and the patients while fostering a culture of cyber awareness that turns every employee into a first line of defense. Mitigation and resilience work hand in hand. Adopting a zero trust approach ensures every user and device is verified before gaining access to data. Network segmentation helps contain breaches if they occur, while encrypted backups ensure systems can be restored quickly after an attack. Artificial intelligence tools can detect unusual activity faster than human analysis, providing an additional layer of defense. Finally, collaboration with organizations such as Health Information Sharing and Analysis Center allows healthcare providers to share intelligence and stay ahead in emerging threats. Looking ahead, cybersecurity will continue to evolve. The shift to passkeys will reduce dependence on weak and easily compromised passwords. Artificial intelligence will automate more aspects of threat detection and response, though we need to carefully manage potential bias and ethical issues. Zero trust architecture will mature, becoming the new standard for access control across healthcare networks. Ultimately, the goal is to build adaptive, ethical, and transparent security systems that evolve with the digital healthcare landscape. These are the key references supporting the strategy outlined in this presentation. Together, they provide the foundation for understanding how healthcare organizations can manage cyber risk effectively, align strategy with budgets, and maintain patient trust in a constant changing digital environment. Thank you.